Hi, I'm Sally Raspberry, licensed acupuncturist, former massage therapist, and yogini. And in my massage practice for 20 years, I saw a lot of people, usually men, come in with lower back pain, and then that would translate into sciatic pain a lot of times. Now, as an acupuncturist and a woman in my 40s, I'm starting to see a lot of women who are having sciatic pain. And that is who this video is for, and that's what this video is about. If you're a man and you have sciatic pain, please use these stretches as well. But this is something that I'm creating specifically for my female patients who are above 40, who are having for the first time in their life sciatic pain. If you're unfamiliar with what that is, there's a nerve that runs down. It innervates at the base of the spine, and it runs all the way down each leg, the back of each leg, all the way into the ankle. And so if you're having pain that's like shooting, sharp, sometimes tingling, and then when it isn't those bursts of sharp pain, it's like this dull, aching, could be throbbing, almost like a hot pain. And this is due to the musculature and the fascia that's all around the sciatic nerve. There's a muscle called your piriformis muscle. And if you picture a triangle, the muscle itself is a triangle. Let's say that my hand right here is your sacrum. Your sacrum is the bone at the very base of your spine that is itself a triangle. Let's just pretend this is your sacrum. There's a muscle that attaches right to your sacrum that is shaped like this triangle, and it comes out and then attaches also at your greater trochanter, which is the hip bone here in the outer part of your leg. It's the top of your femur is your greater trochanter. The longest bone in your leg and in your body is called your femur. So at the very top is the greater trochanter. The piriformis attaches there, and then it goes in its triangle and attaches right to the sacrum. So people have pain in the butt when they have piriformis syndrome, which is where the piriformis usually is weak from underuse. And people can also have sciatic pain because that sciatic nerve runs right through the piriformis, or under the piriformis, or over the piriformis. Our anatomy as humans is pretty similar, but there are some small differences. So everybody's body has a different way that the sciatic nerve and the piriformis interact with each other. But if you're having any sort of sciatic pain, your piriformis muscle is going to be involved. So that's one little piece of what's happening when you're having sciatic pain, is that piriformis muscle has gotten underuse, and the weakness there is creating some inflammation, and it's creating some pressure on that sciatic nerve that runs all the way down the back of the leg. So you might be feeling the pain in the hamstrings, or you might be feeling it all the way into the middle of your calf. Everybody's different. I personally have been, for the last 2 years, now and then I get a little flare-up of sciatic pain. So for the first time, I understand this in my own body rather than just hearing it as symptoms from my patients and clients. So I've devised a way to get rid of my sciatic pain when it happens, and I want to share these stretches with you. They're simple but not easy, and they can prevent further need. Like, they prevent need for you to get further treatment through surgery, cortisol shots, whatever you might do that might be kind of at the severe end of making changes to get this pain to go away. We're going to try and get to it before it gets to that level, because I do know that living in pain, it's not fun and it's not possible once it reaches a certain part. So let's try to come at it with these stretches, and hopefully this will help you and get you through so that you can get stronger. You want to get stronger in your glutes and piriformis, and you want to get looser in your hip flexors. In the body, we have antagonizing muscles. There are opposing muscles throughout our entire body. It's a beautiful way our bodies work. The muscles that are antagonistic for the piriformis muscle are these hip flexors in the front. So psoas and all of the hip flexors here. So the very first thing that we're gonna do if you're having sciatic pain, 3 times a day, you need to be stretching your hip flexors. And these get tight because we're sitting a lot, okay? One way to stretch the hip flexors is by straightening your leg and opening back here. If you are accustomed to doing yoga, you can notice that this is sort of a modified swan pose or pigeon pose. And if you don't do yoga and your body doesn't make this shape, don't worry, I'll show you how to stretch those hip flexors in a moment. So with your leg just straight up behind you, the leg that's getting the stretch on me is my left leg, the one that's out behind. You want to just sit and hold this stretch for 30 to 60 seconds. I'm not going to make the video so that the stretches are the actual length because that's a bit much. And I want you to stay with me. But I want you to hold this stretch until you don't feel it anymore. And that's gonna take 45 seconds to a minute or even more. You might hold it for 2 minutes and that's okay. What we're doing is opening the fascia, the connective tissue on top of the muscles, and telling the fascia, hey, I need you to let go. I need you to soften and open. You don't have to be strong anymore. You need to be loose and open. These get real strong when we're doing lots of sitting, as I said. So now that I've got that stretched out, I would do the other side, the right side, but we'll just do one side for each of these things to keep the video concise. After we stretch our hip flexors, we want to also go ahead and stretch the fascia that's surrounding the greater trochanter. You can do that in a pose. There's a few poses I'm going to show you. There's one called fire logs, where you stack your ankle on top of your knee, and that also lines up your other knee to be right over your ankle, and you lean forward. This is a rather advanced yoga pose, so I'm going to back out of this in a moment and show you an easier pose. As you do this and as you lean forward from your belly toward the floor, you'll feel that outer leg just really open and soften, and that fascia surrounding your muscle begins to just relax and loosen. You want to deconstrict in your outer hip area. So as you can see, when we started, my knee was way off of my ankle, and just from doing that for 30 seconds, the knee is already down. If we did it for the full amount of time, the knee would eventually rest directly on the ankle. If that pose is not available to you, you can have one leg in front, one leg inside, and this is called Sukadiya pose or easy pose. This is also not accessible to everyone, so just give me a moment and let me go through this part, and then we'll go through some different things you can do to get the same effect with the different pose. Again, here with one leg in front of the other, we're gonna lean forward with the belly toward the floor. The intention is to lean forward from the hips, not to cradle forward like this from your shoulders. And we're gonna lean down as much as we can and really open up that left hip because it's the left leg in front. And we would hold this for a full minute, just like we did with the hip flexors. I'm gonna slowly back out of that. So we've stretched the hip flexors, we've opened the fascia on the outside of the greater trochanter, and the next thing we need to do is strengthen the piriformis and the gluteal muscles. I'm gonna sit on a book to do this. In fact, after we are complete with our exercises, I'm going to suggest that whenever you're sitting, whether it's in a chair, in the car, in your office, at the dinner table, on the couch, your hips need to be more elevated than your knees. The knees should always be lower than the hips, and that gives you great hip health. So here, just seated on the floor, in whatever position feels good. If you'd like to sit in a chair with your legs just flat on the floor, you can do that as well. But we want to engage the glute muscles. You just squeeze your muscles together and release. Squeeze and release. And if you're sitting on the floor, this is gonna make you pop up a little bit and then go down. So I like to engage my glute muscles while I'm driving. To and from carpool is the longest amount of time I'm in the car every day. I've got 2 hours in the car, sending my daughter to a really great school that's 30 minutes away, and that equates to 2 hours of driving every day. All that sitting is murder for the hips. It's not good for us, it's not okay, but sometimes it's life. And so we've got to do these strengthening exercises to keep the back of our hips, our gluteal muscles and our piriformis, we want to keep that strong, and we want to keep these nice and stretched out in the front. So squeezing and dropping, just engaging the muscle. Squeeze, 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 squeeze. That's one way to strengthen the glutes. Another way to strengthen your glutes, we'll stand for this part of the video. This one I like to do holding on to something. I've got a chair here. So with the chair in front of you, you're gonna stand and just lift your leg behind you. This can also strengthen your lower back, but it does put some pressure on the lower back. So maybe do 10 times and then switch to the other side. Another great thing to do to build glute strength is to use the stairs instead of the elevator. So anytime you have an opportunity or a choice, whether to climb stairs or go in an elevator, take the stairs. Get your hip muscles nice and strong in the back so that these muscles can stay open, because remember, they're antagonists, and the more open your hip flexors are, the more strong your glutes are, and likewise. So we don't want to have super strong hip flexors here, because that equals weak glute muscles, and that equals your sciatic nerve is not in alignment and it doesn't feel good. So I hope that's been helpful. If you weren't able to follow along with the poses that we've done so far, let me now offer some different ones that are standing up. So to open the hip flexors while standing, again, you just use your chair. We're just gonna fold the foot up. Hold onto the chair so that you have good balance. Hold your foot in your hand and just pull your heel towards your bottom. And you're gonna feel it. You're gonna feel it in your quads, but you're also gonna feel it extend up into the hips. If you're not feeling it very much, you can pull your foot even closer to you to get more of an opening in the hip flexors. And again, you would hold this until you don't feel it anymore, because that's when you know your fascia, not just your muscles, but your fascia, has fully opened and released. And then you can let that go. And then to get to the outer hips without folding your legs in front of each other on the floor, you can do a figure 4 while you're standing up holding the chair. So I'm just gonna put my foot in my lap and just kind of fold forward that way while standing up. And this can be a little easier for a lot of people who aren't as comfortable getting on and off the floor. Again, leaning forward until you really feel that sensation in the outer hip. And the key to this working is to hold it for 45 to 60 seconds, or as long as it takes for it to stop hurting. We never want to push ourselves to a point of pain, but if you're uncomfortable, that's right where you want to be. I hope this has been helpful. Remember, when you sit on a block, a blanket, something that lifts your hips slightly more than your knees. I like to sit on a book, but you can do a yoga block. Do it in the car, at the dinner table, at your office, on the couch, hips above knees. Stretch your hip flexors 3 times a day. Stretch your outer hips 3 times a day. Strengthen those glutes at least once a day. Take the stairs when you can. I promise this is a recipe that I've had to use probably once or twice every year so that my sciatic pain goes away completely. If you're a woman over 40, we're slowly declining in the hormones that keep us from feeling pain. Estrogen is a great analgesic, and as it starts to decline, we start to feel things that we haven't been feeling before. Also, as osteoporosis may set in, and as the bones get weaker because the muscles are not pushing on the bones as much, that's another way that we start to lose strength. And whenever we're losing strength, it's going to change the anatomy of the way things are in our hips and pelvis, and that does affect the sciatic nerve, and then we start to feel the pain from that. So we want to be strong, we want to have strong bones, we want to be flexible, but in the right places. You want to be flexible here and strong here. I hope that's been helpful, and I hope that you are pain-free and enjoy this video.